Dr. John McDougall. I get asked a lot about supplements to help with diabetic neuropathy, which it means that you have diabetes, which has resulted in nerve damage due to poor blood supply and due to other factors involved with this metabolic problem of diabetes. And as a result, you get diabetic neuropathy. And what you feel is you feel numbness, you feel tingling, you feel burning in your feet, sometimes to the point where it's so distressful, it ruins your life. I want to mention to you that neuropathy comes from other causes besides diabetes, but most commonly, diabetes is at the root of developing this condition. So, if you eat a good diet, you're not going to get type 2 diabetes or type 1 diabetes, by the way. And if you eat a good diet, you won't be at risk for having diabetic neuropathy. And I believe that the other kinds of neuropathies are also diet related. Some of them may be due to environmental poisons, but the food is our closest contact with the environment. Well, the first thing you want to do when you have diabetic neuropathy, if you are in that condition, is you want to cure your diabetes. And type 2 diabetes is 100% curable with a change in diet and associated weight loss. So that's the way you want to approach it. And then you ask, are there any studies that specifically deal with diabetic neuropathy and diet? And I say there are. There are a couple of them that I can think of. One done by Weimar Institute. And they showed that of a little over 20 people, they put them on a healthy diet, similar to what we recommend, starch-based, fruits and vegetables, no added oils. And 17 of them got cure of their diabetic neuropathy. And they maintained that cure for 4 years. That was as long as the study went. And most recently, Neil Bernard of the Physicians Committee for Responsible Medicine, PCRM, they published a study that showed benefits from the diet for diabetic neuropathy. People got better. That's what you need to do. Change your diet. And you say, well, it's not always cured. Yeah, you're right. It's not always cured. And then you want to look for other things. And there are medications that doctor prescribed that are somewhat helpful. They just kind of fool the nervous system a bit. And you can try those. The next thing you'll go to is supplements. Vitamin B6 has been recommended, but more commonly and more probably you heard about is taking alpha lipoic acid, which you buy in a natural food store. I've got a couple of studies that say that vitamin B6 is basically useless, but you can give it a try. Not going to do you much harm. And I've got 2 major studies on alpha lipoic acid that show that it is a benefit for people who have diabetic neuropathy. Alpha lipoic acid is. One is given by pills, the other is given IV. But I've had dozens of patients that I have recommended that they try alpha lipoic acid. And not a one of them, as I remember, came back to me and said, Doc, that worked. So don't be disappointed. I think it's worth a try for you to get into some of these supplements. They're relatively inexpensive, relatively non-toxic. Give it a try. What do I mean by a try? If it hasn't fixed you in 4 months, it ain't going to fix you. So, anything reasonable, cost-effective, and non-toxic, give it a try. Give it 4 months, no more than that. If it works for you, fine. If it doesn't, keep plugging along, keep doing what you can do, and you don't want to end up with any further problems. So the quicker you learn a starch-based diet with fruits and vegetables, the better your life will be. I'm Dr. John McDougall. It's been a pleasure talking to you. Thank you very much for listening.